Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with me is Dr. Marlon Hagerty, who is a radiation oncologist at Thunder Bay Regional Health Science Center, and he's also assistant professor at Northern Ontario School of Medicine. Cancer patients receive variety of modality of treatments, which may include chemotherapy, radiotherapy, surgery, or targeted therapies. Radiation therapy is very important and life-saving treatment. Many of the cancer patients who receive radiation treatment have variety of questions, which includes what is radiation, how does the radiation act, what are the side effects, will I be able to work during the radiation treatment, and so many other questions. To answer all these questions, we have Dr. Hagerty with us. Welcome, Dr. Hagerty, for the show.
Hi, good to be here.
Thank you for coming. Please tell us, what is radiation therapy, or what is radiation? How does it different from the X-rays, which also include radiations?
Radiation is hard to understand because we don't see it, we don't feel it, but it does affect us when we're treated for our cancer. So what is usually used for radiation therapy in Canada is either high energy photons or high energy electrons. They're basically little, think of waves or beams of energy that will pass through the body. But as it passes through the body, it can affect the tumor cells or the healthy cells of the body. And that's why we studied for a long time to figure out how to use the power of radiation therapy to fight cancer, but also keep it safe for patients.
So how is radiation therapy different from the X-ray radiations?
Well, X-rays are passing through the air and coming from space, and that's completely different. That's a cosmic radiation. When we use radiation therapy for cancer patients, we're actually producing the X-ray beams or the electrons with the machine. When you take an X-ray for like a chest X-ray, if that's what you're asking about,
yes,
that's lower power X-rays, and there's an imager behind the patient, and as the X-rays for that are used, they'll pass through the body, and then if there's a lot of tissue in that area in the body, then there'll be less X-rays that pass through to the imager, so that helps make an image.
So the X-ray which we take for diagnostic purpose have a low dose as compared to the radiation therapy, is that right?
Yeah, it's a lot lower dose. So we use much higher amounts of radiation, and it's targeted to the cancer cells to kill them.
So these cancer cells are killed by the radiation, but won't they also kill the normal healthy cells then?
They can, and so that's why we have to do a lot of detailed planning and a lot of calculations to make sure we focus the radiation on the tumor, and then the surrounding tissue gets a lower dose of radiation that's still going to be safe for the patient.
So do you use some sort of a shield or mask or some sort of a covering to protect the normal cells, being normal tissue, not getting exposed to the radiation?
Not usually. Sometimes that's done for very unique circumstances, but usually what we do is we do three-dimensional calculations. So we have the patient go through our scanner first, and then we see their anatomy in 3D, and then what we do is we will do calculations. So as the beams of radiation pass through from different angles, we can calculate how much radiation will be focused on the tumor and how much goes onto the normal tissue. And we have limits on what we know is safe for the surrounding tissues. So even though there's some radiation that gets onto those tissues, we make sure it's going to be safe before we would treat anybody.
So is radiotherapy like a patient undergoes some sort of a machine, or how does the radiotherapy is being given? Like, is there any machine or any injection, or how is the radiotherapy being given?
Well, there are a couple ways to do it. most typical way to do it is called external beam radiation.
External beam radiation.
Yeah. So that would be where a patient would lay down on a bench, and they would have tattoos on their body. So if we were giving radiation to like a lung cancer, for example, they'd have tattoos on their chest, on the top and on the sides. And there'd be laser lights that come out of the walls and the ceiling that help line up the body in the right place. Then we take X-rays to make sure they're lined up on the inside. Sometimes we can even see the tumor be moving up and down, like in the lung as the patient breathes, and we account for that movement. So once they're all lined up, then we turn on the radiation machine, and it's basically a big arm, and it rotates around the body and shines radiation in from different angles.
Or it's like a patient undergoing like a big CT scan machine. Is this something like that?
It's a lot bigger machine than that.
Okay.
A lot of the machine you actually don't see because it's behind the wall in the room.
Okay.
But it is a big arm, and it rotates all around the patient.
Right. Now that is external beam radiation. Is there any other way you give the radiation?
Yeah, so there is one kind called brachytherapy, and that means we give radiation as the source of radiation coming from inside the patient. So what happens is that the patient may be under anesthesia for that, if it was for prostate cancer, for example, and you would insert hollow needles in behind the scrotum of the patient, and they wouldn't feel it because they're under anesthesia. And then what happens is a machine will bring in a radioactive pellet that will go into the hollow needle and then slowly come out and stay in a specific position for 1 second or 2 seconds, and then move out a little bit, and slowly come out of the needle and then go into the next needle and the next needle. And over 15 or 20 minutes, what will happen is that whole area of the prostate would be receiving radiation from the inside of the organ. So that's called brachytherapy. We also use brachytherapy for cervical cancer patients. That's a very common thing. And the patient would be under anesthesia as well. And we would put in an apparatus into the vagina and then up into the uterus.
Into the tumor, yeah.
And so the whole area of the uterus and the cervix and the lower and the upper vagina would be treated with radiation, and that's coming from the inside of the patient.
So external beam radiation, like it's from outside, and brachytherapy is the radiation is injected into that particular organ specifically inside. Is that right?
Yeah, so it's coming, the source of the radiation is from a radioactive pellet, and so that's always giving off radiation. And basically the pellet is stored in a machine that's protected by lead, and then we bring it into the operating room, and then once the patient is ready, that pellet will come out of the protective casing and then just stay inside the patient for a very short period. And as that happens, it gives off radiation.
Thank you, Dr. Hagerty. We'll take a short break and we'll come back for the next session. Thank you.
Welcome.
Thank you.